Right, so this will be our fifth classification of drugs. And earlier on, we made an overview video, and I told you guys that okay, there are some specific criteria that we actually classify drugs under, and I gave you guys a mnemonic for that. That was the CST, MPT, EPL. The C stands for what? The C category stands for what? The C category of classification stands for, all right. So the C there stands for what? Chemical nature. The uh, S stands for source of the drugs, and the T stands for therapeutic use. That's classification of drugs based on therapeutic use, all right, and the rest of them. If you want a video on the overview of classification of drugs, the various criteria we use in classifying drugs, you can just comment so I send it for you, okay? So guys, the fifth classification now is a classification of drugs based on therapeutic use, all right? And classification of drugs based on therapeutic use is basically why are you using these drugs? Okay, so you could be using drugs for antimicrobial action, antihypertensive, or high antipsychotics. Okay, so come back fully to that. Let's just have an overview of what the lecture will be like. So, drug classification, drugs are classified to ensure that the drug is used safely and that you get the greatest possible benefit with the lowest possible risks. Okay, so you can't be using a drug that is meant for headache. You are using the drug meant for headache to treat let me say a blood disorder. Do you understand? So you must actually always use drugs meant for specific conditions for those conditions, right? So the various classification help us to actually identify who the drug might better suit for and who should avoid it. All right. So also identify interactions that affect the effectiveness or safety of the drug. Okay. So now we'll be talking about classification of drugs based on therapeutic use, and we'll be listing some few examples because these are not all. Okay. You can just find out about the rest for yourself, but at least it's good to know that there's a classification of drug that is based on therapeutic use, right? So some drugs could be antimicrobials. These are the ones that are actually fighting all those microorganisms that might infect you, okay? And examples are what? Aminoglycosides and quinolones. Then we have antihypertensive drugs. These are examples are what? Clonidine and hydralazine. Hydralazine, okay? Hydralazine. Then we have the antipsychotic drugs. Those are the haloperidol and the chlorpromazine, okay? So the haloperidol and the chlorpromazine, okay? So these are basically the classification of drugs based on therapeutic use, okay? So there are other therapeutic use like, okay, there are drugs for what? Contraception, there are drugs for headaches, there are drugs for vomiting. Do you understand? Just therapeutic use, right? Just reason out, okay? Why am I using these drugs? For what? To cure what? Okay, that's what therapeutic use means, right? So these are just few examples. You could just look up some other examples, or as you continue reading, you come across different drugs and you find out their different use, and that's where you actually develop a very full list of classification of drugs based on therapeutic use. Okay, so guys, that's it about the fifth classification of drugs, and bye for now.